Today, we are jumping into the really high-stakes world of antiarrhythmic drugs. These are the powerful medications doctors use to pull the heart's rhythm back from the very edge of chaos. So think about it like this. Your heart is this incredible, perfectly synchronized orchestra. Every beat is a note, played in perfect time. But what happens if the conductor just disappears? Well, you get chaos. The rhythm becomes erratic, unpredictable, and frankly, pretty dangerous. And that's the core problem we're going to tackle. In the medical world, that chaos has a name: arrhythmia. It's basically an abnormal heart rhythm where the electrical signals in the heart just start misfiring. It can cause the heart to beat way too fast, way too slow, or just all over the place. So how do we get that orchestra back in sync? How do we fix this mess? Well, that brings us right into our first section. To bring back some order, we need to look at the main set of tools doctors have, the different classes of drugs that can step in and act like a new conductor for the heart. And the solution, of course, is antiarrhythmic drugs. What they do at their core is pretty amazing. They go in and they actually modify the electrical pathways in the heart. They're designed to calm all that chaos down and bring back a steady, stable rhythm. Now, trying to remember all these drugs can be tough, but luckily, there's a fantastic little mnemonic to help us out. Some block potassium channels. It's so simple, right? And that phrase gives us our four main classes: sodium channel blockers, beta blockers, potassium channel blockers, and calcium channel blockers. So let's meet the team. Okay, this is where it gets really cool because we can kind of give each class its own personality. So you've got Class I, the sodium blockers. Think of them as the pace setters. Their whole job is to slow those electrical signals down. Then there's Class II, the beta blockers. They're the calming influence, just lowering the heart rate and overall activity. Class III, the potassium blockers, are the pause givers. They actually make the rest period between beats a little longer. And finally, Class IV, the calcium blockers, are the gatekeepers, slowing down signals as they move between the heart's chambers. Each one has a specific job, and believe it or not, each has its own mnemonic to remember the specific drug. So that's the standard playbook. But what happens when things get really, really serious? You know, in a life or death emergency, doctors need a whole different set of tools, ones that are built for fast, decisive action to fix that beat immediately. And for those critical moments, you guessed it, we have another great mnemonic: ATOM. This one stands for adenosine, used for super fast rhythms called SVT, digoxin for the chaotic rhythm of atrial fibrillation, amiodarone, which is kind of the jack of all trades, and magnesium for this very specific, deadly twisting rhythm called torsades de pointes. But out of those four, one of them stands out. It has a method that is incredibly dramatic and unbelievably effective. It doesn't just tweak the rhythm. Nope. It's basically the ultimate reset button for the heart. The drug is adenosine. And yeah, you are reading that slide correctly. To fix a heart that is completely out of control, this drug literally stops it. It brings all electrical activity in the heart to a screeching halt just for a moment. For about 6 seconds, which feels like an eternity in that situation, the patient's heart monitor will show asystole, a flat line. It's a controlled, temporary stop that's designed to give the heart's natural pacemaker a chance to take back control and restart the rhythm properly. It is terrifying and brilliant all at once. Now, as you can imagine, this is a very intense experience. Patients are always warned right before it happens. They often say it feels like a sudden, heavy weight on their chest, or even like being kicked. That's the physical sensation of your entire cardiac electrical system getting a hard reboot. And this brings us to a really, really crucial point. These drugs are unbelievably powerful tools, which also means they come with some serious risks. It's a constant balancing act. And there is no drug that illustrates this high wire act better than amiodarone. It is one of the most effective antiarrhythmics out there, capable of controlling some of the absolute worst arrhythmias. But all of that power comes with a price. In medicine, amiodarone is often called a dirty drug. Now, that doesn't mean it's bad or contaminated. It just means it isn't very specific. It affects a ton of different systems all over the body, not just the heart, and that leads to a very, very long list of potential toxicities. Part of what makes it so tricky is its ridiculously long half-life. I mean, look at this timeline. A patient could stop taking the drug, and 40 to 55 days later, half of it could still be in their system. It can take months for it to fully clear, which means its effects and its risks stick around for a long, long time. And those risks? They are significant. We're talking about potentially fatal lung damage, serious liver toxicity, and thyroid problems because the drug itself actually contains iodine. It can even cause this rare but pretty startling side effect known as blue man syndrome, where skin that's exposed to the sun can turn a blue-gray color. So it is absolutely critical to distinguish between common manageable side effects, things like dizziness or fatigue, and the severe adverse effects, like making arrhythmias worse or causing that life-threatening organ damage. This is exactly why constant, careful monitoring is just not optional. So, before even a single dose of these drugs is given, there is a super rigorous checklist. Clinicians are analyzing the ECG, checking blood pressure, reviewing electrolyte levels, and this is a big one. They are verifying the exact type of arrhythmia. They have to make sure they're using the right tool for the right job to avoid doing more harm than good. And that vigilance doesn't stop once the drug is in. After it's administered, the patient is watched like a hawk. They're looking for a heart rate that's dropping too low, watching for falling blood pressure, and keeping an eye out for any of those early warning signs of toxicity. It is a process of just constant, careful watchfulness. So, when you get right down to it, these medications are truly double-edged swords. From the dramatic, heart-stopping reset of adenosine to the powerful but dangerous effects of amiodarone, they all walk this razor's edge between a life-saving fix and a serious risk. And that leaves us with one final thought. How does modern medicine continue to get better at mastering this incredibly delicate balance?